Welcome back. It is 8:14. A Michigan man is working to prevent suicide and promote mental health through the power of connection. After losing his brother to suicide in 2022, Portland native Ethan Getchell's life took a completely new direction, focused on helping others who may be struggling. And he is joining us live in studio this morning to tell us about his story. We appreciate your time. Thank you so much for making the journey over here. First off, let's start with your story. What exactly led you down the path to living a life of, making mental health more clear for people in the future?
I come from a construction background. My dad's in construction management, and I was actually on track to go into commercial construction. And it was 2022, like you said, and after he passed away, it really exposed me to the silent suffering that young men go through. So after he passed, I decided I don't want to go into commercial real estate anymore. After talking to some mentors, they were like, well, what do you really want to do? I was like, I want to sit with these young men that are struggling in silence. So I pivoted. I applied to U of M and got my master's in social work.
Wow. So a complete 180 in terms of career change because of this, first off, terrible tragedy that happened. We're very sorry that happened to you and your family. But now that you're using that situation in a positive light, trying to connect with others, what has that looked like for you so far? I mean, obviously you went over to U of M. What else has your work entailed?
Well, now I'm a clinical social work fellow at Michigan Medicine, providing therapy for children and adults who are struggling with depression and suicide. And some of the things that I found out is that men die by suicide 4 times more than women. They're 3 times more likely to struggle with addiction, 12 times more likely to be incarcerated. So all of these things really show that there's this silent epidemic in young men, older men. And I found that older men, 50 plus, are the ones that are dying at the highest rate of suicide. But interestingly, the rate that's increasing the most is young men, 15 to 30. So when I heard that this demographic is at the highest increasing rate of death, I was like, that's where I want to go. That's the space that I want to be in, because why are these young men dying at such high rates? And it affects me personally. It happened to my brother, and so I got really curious about that, and so that's where I've been spending the last 2 years.
Yeah.
Yeah. Tell us more about how that personal connection now helps you as a social worker.
It allows me to empathize with the people that I'm sitting across from, more from the grief standpoint. But one thing that I found that really connects grief and depression is this bridge for hope. And I think hope is really what is needed at the center of both of that work. Hope for me in the grief that I go through, but hope for those who are sitting with depression and suicidal ideation.
Yeah. You mentioned construction workers. Your family has a background in construction work. We have a study that was recently published by the National Library of Medicine. It says 7.4% of the workforce is, of course, construction workers, but they account for 17.9% of suicides. And that's according to statistics from 2021, but it was a study published this year. So construction workers are disproportionately, impacted by this. I mean, your reaction to that as somebody with a family in that background, obviously these people are more impacted than other demographics across the country.
Yeah, absolutely. And it was surprising, but not surprising at the same time, from being exposed, growing up, being in the culture, poured concrete for 3 summers in high school. And so it's really just created this blend of personal experience, losing my brother, professional experience, working with people, to this demographic that needs this message. And so I've crafted this keynote, Hope and Hard Hats, that I'm trying to get in front of construction companies, sharing with them, talking about how it's okay to share what you're going through, because like we can see, there's a real need for it.
Yeah, absolutely.
And we have seen some growth in recent years in terms of people's openness to talking about their mental health, but there still is a fairly large stigma surrounding it. And what message would you want to give people who are silently struggling and maybe just need to take that step to sharing with someone?
Yeah, I think the pandemic was really revealing for people to not have a lot of interaction with other folks and to sit back and introspect and be like, wow, there are things going on. And sometimes it can be hard to say that I'm struggling. And it's helped, I've seen it help people who, when I could say, what would your kids need? What would you want your kids to do? And that's able to sit back and say, okay, I think I do need to say something. I need to share something here. So empathizing and being vulnerable, I think, are at the core of what can be helpful.
Yeah, you have already done some work. You've done some different speaking engagements. I'm assuming you've gotten to talk to a lot of people in your work getting your master's there. In that experience over the last several years, what is like the one thing or maybe a couple things that stick out to you as like the most concerning when it comes to mental health and suicide rates? What's the most concerning thing to you right now?
I think one of the most concerning pieces is, like I said, the young demographic of people who are dying by suicide. And when we think about the older group that are dying by suicide, it's a lot to do with retirement, losing that sense of purpose, that job that you previously had. So why is it happening in the younger demographic? That same sense of purposelessness. So why are these young folks struggling with purposelessness and isolation? And I think it has a lot to do with feeling like a burden, not knowing how to express yourself, feeling hopeless. So the hopelessness, the burdensomeness, and the isolation, I think, are the most concerning pieces here.
Yeah, you have a lot of really good observations, and I'm just curious as to, what you think can be done right now to kind of help those young men, young people in general, or just really anybody. What can be done right now to help people overcome, especially during a time like right now? It's the holidays. We're in like the darkest season of the year. It's winter. We hear about seasonal depression all the time. What do you think can be done right now to help people realize there is hope out there?
Simply put, connection is protection. If we can be around people in person, put our phones down, look eye to eye with each other, we can learn a lot, we can hear a lot, we can listen with our eyes, we can be present with each other, and that is healing right there.
Yeah.
For those who are feeling that hopelessness, that depression, what steps do you want them to take?
Reach out, say something, tell your parent, tell a friend, tell your therapist. Professional help is out there. Tell your doctor. 988 is a great hotline if you're dealing with suicidal ideation.
Yeah, and what sort of work are you doing to kind of help raise awareness, break the stigma here, and help some folks out?
I'm posting on LinkedIn daily, so you can find me at Ethan Getchell. I also have a website, ethangetchell.com. I'm constantly looking for booking engagements, working with construction companies, but I've also spoken with schools and colleges and really anybody that needs this message.
Yeah, absolutely. What's next for you in your journey here to help raise awareness and spread awareness in this, I would say it's an issue, the mental health awareness for sure.
I want to continue growing in my private practice, sitting with people individually, like to keep speaking with groups, and eventually publish a book, kind of sharing both of these, the findings and the experiences that I've had.
Okay.
Absolutely. Well, that's such incredible work, and thank you for, giving up your initial career and kind of taking this change to help people in their mental health, because there are so many that are in need of it, and we need more people like you to be able to help everyone through it.
Absolutely. Where can people find more information? I know you just said your website. Where can people get in contact with you, though?
LinkedIn's great, DM at Ethan Getchell, but also my email is on my website.
Okay. Ethan, we appreciate your time this morning. Thank you so much for all you're doing to help raise awareness, and good luck to you in your mission there.
Thank
we
you.
appreciate
Thanks
it.
for having me.
Okay.